My name is Peter Swanljung. I am the Chief of Psychiatry for the Malvern Institute in Willow Grove, Pennsylvania. We are a treatment program for substance abuse. I'm board certified in psychiatry and addiction medicine, specializing in patients with addiction, but also in patients with mood disorders and other conditions. I've been working for about 4 years with Malvern.
Very good. Thank you, Peter, for your time for this. And so we're talking about people facing transplant, after transplant, dealing with some of the cancers that come after transplant, and all of this is associated with a topic that we haven't addressed elsewhere, and that's about stress. So maybe you can give me, from your medical background, what is stress? How would you define it?
Okay. There's a few different ways to look at stress, defining it, but in general, stress is a pressure or a tension or an uncomfortable emotional feeling that a person experiences caused by various factors. There are different types of stress that people can experience. People may experience acute stressors on a day-to-day basis. An acute stressor can vary in intensity. Some can be mild, like being stuck in traffic. Some can be more severe, like getting in a car accident. A stress is anything that causes an emotional response of discomfort, tension, pressure, and leads a person to feel like they are maybe overwhelmed.
So the world we're talking about, we have the situation where a patient is sick for some period of time, sometimes a lifetime. That is certainly a stressor. Then they get to a point where transplant, organ transplant, is the option that are offered. And so you're waiting for an organ transplant or being evaluated for one. That's a stressful time, making sure you meet the criteria. And then finally you're waiting, you're on the waiting list. And so you have the stress of not knowing when this is going to happen, unless you have a living donor. And so that stress you live with for any period of time, could be years, waiting for a life-saving organ transplant. Finally, the call comes, and hopefully it's not a false alarm, but if it is, you go through a stressful period there, and then finally you get the organ transplant surgery. You have a period of recovery afterwards while you're in the hospital, so you have a lot of support there, but still very stressful with this new life you now have. And finally you're out of the hospital and you have long-term recovery, and finally long-term living with the issues that come with that, including the higher risk of cancer. So you face issues with age and different conditions, and all those come with stress. You also have the family on the other side dealing with this. So talk to me a little bit about what that would be like. What are the positive and negative effects of stress in a person's life?
Some of the things you described are factors that can cause a person to have chronic stress, where this is stress over a longer period of time. And chronic stress can include health problems.
Caused by or can produce health problems?
Both. So illness can cause stress. And for example, a transplant usually involves that someone's suffering from some sort of an illness, which is very stressful, both for the patient and their family. Along with that come other stressors. Oftentimes when someone's ill, it affects their employment or their finances, and that's extra stress, because that's another factor that has to be worried about and puts extra pressure on a patient and their family when they're dealing with these things. There are a lot of different stressors that go along with a chronic illness, and especially somebody who has to go through a transplant, some of them that you mentioned. Overall, sometimes the reaction that a person has to stress could have positive factors and could have negative. The reason that we react the way we do to stress is the body's way to cope with stress. So when we feel we're in some kind of danger, or we're feeling threatened in some way, then the body reacts. And
Flight or fight, is that kind of thing?
Fight or flight,
okay.
Yes. And the body will often react in that way to protect itself, which could be a good thing. If you're in some danger, you want to have that response where You get more energy, you're more on edge, you're able to defend yourself better. However, which can be in handy if, say, you're being attacked by a pack of wolves or something. But over time, if you're having repeated stress or ongoing chronic stress, it's not necessarily a good thing because it can take a toll on a person physically and emotionally in a negative way.
How does it affect the body negatively?
Different ways. In the acute setting, when there's an immediate stress, say for example, you get the news about having an illness, or you get the news that you need to have a transplant, you may react to that by a release of adrenaline, where the heart will beat rapidly, may breathe more rapidly or feel short of breath, may start to sweat, may feel nauseous, may feel shaky, feeling anxious or restless, may feel a headache, may feel fatigue, various symptoms that can be a result of that acute reaction to that stress. And those are unpleasant feelings that a person goes through. They aren't necessarily harmful in the short term, but they feel unpleasant, and if that happens repeatedly, it can take a toll. Over time, if someone's under stress over a longer period of time, that ongoing stress reaction, which includes the adrenaline release and then also cortisone is also released under stress. Together, those can have effects on blood pressure, coronary artery disease, increased risks of heart attack, can cause depression, anxiety, increased risk of substance abuse, obesity, insomnia, and various weakening of the immune system and various other sequelae from the stress.
I thought of something else, another stressor that we haven't talked about, and that is the concern, especially a breadwinner would have. You mentioned financial, and all of a sudden I thought another big stress for people who are the breadwinners, especially when they're in their career someplace, is they're out of work. Where they're going to get long-term money for the family? What happens if they don't make it through this? So could you talk about that aspect of it, the stressor of worrying about the welfare of the family if the transplant doesn't turn out well, or if it's long-term unemployment?
I can see that there would be a lot of anxiety and stress for somebody who is undergoing a transplant or having a chronic illness of various kinds, because often due to the illness they aren't going to be able to work, maybe because they're too sick to work, maybe because they have to take leave off to have surgery and recover, and they also have anxiety over how likely is it that they'll recover and be able to return to work and provide for themselves and their family and maintain their health insurance. So these are realistic stressors that a person has to face and deal with when they have an illness or going through a transplant.
Let's talk a little bit about what can a person do to deal with the stresses that are involved as we've discussed them. How can they handle those most effectively in a positive way?
I think one of the most important things when someone is going through a stressful time, especially a medical issue or a medical illness, is reaching out for support. But even before that, a person has to recognize when they're under that stress, because if you don't realize it, you can't really reach out for support and get the help. So it's a normal thing when someone's going through illness or medical procedures to be under stress. It would be unusual for that not to be a stressful situation and not to feel that stress. And I think that one of the most important things is to reach out for that support, because people are going to want to be there to help someone through that difficult time and provide that support. And oftentimes the families will feel better the more it's talked about, and they can support each other through that stress that they're all sharing together.
So the first point would be recognition of the stress. Second sounds like communication with those around you, the caregivers, your network.
Yes, and then I'd say another thing that's really important, which sounds very simple, is taking good care of oneself. So good self-care. Whenever someone's dealing with anxiety or depression or stress, one of the main things that often slips is taking care of just the basic things that a person needs day to day. And by that I mean things like eating healthy meals. A lot of times when people are under stress, they're just not hungry, they forget about eating, they're too busy to eat, they have too much on their mind to think about it, but it's important. The body needs that nutrition to feel good and to stay healthy. Also, getting enough sleep is important. A lot of times when people are under stress, it interferes with their sleep. They have trouble falling asleep. So it's important to have a quiet setting to sleep in, and set aside enough time to get sleep, a dark place to sleep, and if someone has trouble sleeping, to potentially talk to their doctor about assistance with medication to sleep. Other important ways to take care of oneself is moving around, moving the body around, getting some exercise as long as it's safe, as long as the doctors that you're working with feel it's okay, or for family members, getting some exercise, even if it's just walking, releasing some of the natural endorphins that make someone feel better. And exercise is a great stress reliever, as long as it's okay with the treating doctors.
Step to the other side, the caregiving family, especially a loving spouse, for example. What kinds of things can you recommend for them to deal with the stress that they're under, or for them to support their loved one with the stress they're going through? So both the caregiver and how can the caregiver help the stress within the patient?
Right. I'd say for helping the patient, I think being available, being available to listen, trying to put oneself into that person's shoes, recognizing that sometimes they're going to be scared, anxious, maybe they'll be a little irritable sometimes, helping them do some things that maybe they don't have the energy to do, helping them set up things like appointments, or if maybe they would benefit from some extra services or extra help that maybe that family member could help put in place. And just overall looking out that family member is taking care of themselves, and also involving other people. Sometimes the patient themselves may not have the energy or want to deal with keeping everybody informed of what's going on, or necessarily reaching out to all the family members, but maybe that spouse or other caregiver could reach out and communicate with the other family and keep them abreast of what's going on.
And speaking to the caregiver itself, the stress that they're under, is there anything different than the many things you've talked about for dealing with stress that could apply to the caregiver undergoing the stress?
I think that it's important for the caregiver to recognize that this is a difficult time for themselves also, that as much as they need to take care of their loved one, they also have to look out for their own well-being and realize that they're going to need a break sometimes, and let others help. If they're the primary spouse or caregiver, doesn't mean that there can't be other family or friends or who can step in and give that person a little bit of a break, because it could be a difficult time where there's a lot of responsibilities to help the person undergoing the transplant or having the illness, and maybe that could be shared a little bit so it's not so overwhelming, and to make things easier for everyone.
Sounds like the advice they give on airplanes. Put on your own oxygen mask first.
Correct.
Got to take care of yourself, or you won't be there for your loved one.
Exactly.
Okay.
So along the lines of the self-care, other things that are important are trying to prioritize things. Sometimes there's extra stressors on the outside that maybe don't need to be dealt with at that time, that could be set aside or made easier, or somebody else could help take care of them temporarily while the person's dealing with their illness or their surgery. And those are important things to recognize, because even in our everyday lives we have a lot of stress, a lot of things, a lot of responsibilities, bills, various other things we have to take care of, and if some of those can be unloaded during the extra stressful time of the illness, it could make a big difference.
One piece that really applies there that I don't think the average patient would think of beforehand is after a transplant, you have a slew of pills that all of a sudden are a very important regimen. And that's a good time to reach out to the family to help you, especially filling those pills or making sure you're keeping up with the timeliness of the regimen. And something that your caregiver can take that stress off the patient by giving that support. And also, there's stress associated with some of the medications that patients go under, such as prednisone. I mean, I don't know how you describe that as a psychiatrist. I describe it as a roller coaster ride for many people while they're on heavy dose of prednisone. Could you talk a little bit about the medical things that cause stress?
Yes. So you're right. Many medications can impact mood and anxiety. Steroids definitely can impact mood. They can cause up and down moods. They can cause a person to have more depression, anxiety. And so that's something that has to be dealt with because sometimes these medications can't be avoided and they're needed for the recovery period. So sometimes it helps for the patient to just have some awareness that this may be a natural part of the treatment and that it's going to be temporary until they're able to get off those medications. But it is important that they talk to their doctor about it in case there's maybe an alternative medication that may have less side effects. And certainly if they're having severe symptoms so that they can get help and treatment.
In today's world where we're I'm going to use the word paranoid, I don't know that that's the right word, about opioids and the addiction of opioids. We'll talk about addiction in just a minute, but just in terms of the stress today of a patient who has not been on these medications, now being given some pain medication because they're just coming out of surgery, how can you overcome the fear of becoming addicted to the pain medication that you have to take because you just came out of surgery?
Well, I think,
any advice?
Yes, I think it's important to keep in mind that it's important in the initial period after surgery to give your body a break from that pain. We've been talking a lot about stress, but pain is a big stressor. And if the body's under too much pain stress, it's not going to be able to heal as well. And also, when someone's in a lot of pain, they're not going to be able to move around so well. And a lot of times after surgery, it's very important to get up and get moving, or else you're at risk for infections, difficulty with recovery, and it slows down the recovery process if someone's not able to ambulate and move around. So treating that pain in the initial days and weeks after surgery is critical. And a few weeks of opioid pain treatment are not going to cause addiction. What's important is that as the pain diminishes, that trying to not rely on those medications excessively and work on tolerating some level of pain as you recover from surgery. But the chance of someone becoming addicted from a short course of opioid treatment is quite low unless they have some past history of addiction problems.
Well, let's talk about addiction just for a minute. In talking to the social workers about this issue in the transplant community, what they say is that if you've had an issue with addictions beforehand, be it alcohol, be it drugs, be it gambling, for example, then there's a high risk of returning to that addiction after the transplant. Another piece of that is guilt sometimes. It comes when a patient is dealing with, and I guess that's not addiction as such. So just talk about addiction in that post-transplant world. If you've had a history of addiction, what can you do to reduce the risk of coming back into that addiction?
For someone who's had a history of addiction and has gone through a transplant, one thing to keep in mind is it is a stressful time, and a lot of people who have struggled with addiction, part of the reason they were in the addiction was to cope with life stressors that they weren't able to cope with in more healthy ways. So, for example, someone who may have had trouble with alcohol use, part of the reason they may have had that problem may be because they drank to deal with anxiety or stress. And what's important after a surgery or transplant is that the focus be kept on the fact that it's important to avoid resuming those old addictive behaviors and to utilize some of the coping strategies and relapse prevention strategies that hopefully that person learned when they became clean and sober from the alcohol or drug that they were previously addicted to maintain that focus on that during that time, because it could be a vulnerable time to return to the prior addictive behaviors.
Let's switch and talk a little bit about one of the addictions I forgot about was smoking. That's a key one, especially in the transplant lung world. But anyway, moving on. Let me just give you a quick background to this one and then take it wherever you want to take it, okay? I'm going to talk about attitude. I think attitude plays a big role in a patient's success and dealing with the stressors that come with it. And yet I hesitate to talk about attitude because it's like you can put a guilt complex on the patient if they don't have the right attitude, and that's why they're having some of the relapse or sicknesses. So talk a little bit about attitude and how some people with a positive attitude can sail through what would be very stressful for somebody else who has a negative attitude. Can you talk to the attitude issue in general as far as stress goes?
Yeah. Some people, I believe, have more of a natural ability to cope with stress. They have maybe a more positive outlook on things, see the glass more half full than half empty. And they may just have intrinsic ability to look at things in a way that helps them get through that stress, or a way to reach out for support more easily. Others may struggle a little bit more with that. They may have a little bit more of a pessimistic outlook on things, and that's not always just easy to switch over. But it is something that can be worked on. They could potentially get some professional help if they really struggle with low mood or pessimism about their condition or about the results of their surgery. Oftentimes seeing a therapist could be really helpful for somebody in that situation, because it is very important to have some hope about recovery from a major surgery like that. A person's more likely to do well if they're taking good care of themselves and feeling good. There is a strong connection between emotional well-being and physical well-being. And so it is really important that if someone's struggling with feeling pessimistic or some hopelessness about something, that they address that and get some help for it.
That leads us into depression. You mentioned it before, and I think it can be a factor for many patients. What can we offer the patient as far as insight how to deal with depression? One, how to recognize it as a factor going with stress, and secondly, can you deal about it? Or more importantly, how can a family recognize depression in the patient, and what can they do to help?
So a lot of times depression will go along with stress. Sometimes ongoing stress eventually builds up and a person becomes overwhelmed, and it affects their mood in a way that they become depressed. Or sometimes just going through a significant medical illness will contribute to triggering a depression. Or someone may have a history of depression and then have a recurrence during this time. Ways to recognize it, sometimes it's pretty clear. A person just looks more down, and that's more of a persistent, ongoing thing. So not just one low day, but they're consistently over a period of days or weeks just not looking like themselves. They look like they have less energy, smiling less, not feeling like doing things the way they used to, not having as much energy. Now this might be a little tricky because when a person's in recovery from surgery or a transplant, they're probably not going to have a lot of energy or feel their best, but if you notice a difference in that person's personality or outlook on things or interest in things, that could be a sign that they're having depression, especially if it seems to go on longer than what you'd expect, after a surgery when they're starting to physically recover, but they still don't seem to have that the normal mood.
So if somebody in the network of family and friends recognizes some of the signs of depression you just mentioned, what can they do to help?
Well, one thing is staying engaged with that person, encouraging them to do things. Some of the same things that I mentioned before about managing anxiety can also be used, are also important in dealing with depression, which is good self-care, staying connected to a social circle, getting exercise when possible, getting counseling. Sometimes it can be helpful to consider medication if the depression is going on long enough, or medication for anxiety. So there are many different directions to focus on when someone has either depression or anxiety. Medication, counseling, good self-care, and avoiding drugs and alcohol.
What kind of counseling resource? I mean, if I'm a patient, I've never been counseled before, I don't know who to turn to. As a professional, what am I looking for as a patient who's facing some of these challenges you're talking about? Where do I turn?
Well, I think oftentimes family could be of assistance trying to locate resources. Probably the social worker in the transplant team would be able to connect someone with potentially a counselor or therapist that has experience in this field. And also maybe they could connect that person with support groups, which could be a great help, where other people maybe going through similar things would be there to share their experiences.
Is there a difference between a psychiatrist, a psychologist, and a counselor? What kind of terms would we be looking for? The social worker would probably put you in the right direction, and you're right. Putting you in touch with somebody who knows something about transplant and the medication to go with it is key. But in terms of those kind of attributes, what am I looking for? Or what are the difference between them as far as resources go?
Sure. Psychiatrists are generally prescribing medication. Some psychiatrists will also engage in doing some of the therapy, but not always. It depends. Psychologists are not trained to prescribe medications, but they can provide different types of therapy services. And a counselor is similar, but counselors could be, it's more of a broad term. It might include social workers, psychologists, and other people trained to do therapy and counseling.
So it's obviously different degrees of education behind. So a psychiatrist almost sounds like a medical doctor versus a psychologist is something less trained than that, and a counselor can be anybody that claims to be a counselor?
It's different types of training. A psychiatrist goes through medical training. A psychologist goes through a psychology program. They may be a PhD or they may have a psychology doctorate. And then social workers may have master's degrees or other training. There were a few other potential ways to manage anxiety and stress that I didn't yet go over. So I'll just go over a few of those. We talked about self-care, we talked about reaching out for support, but there's also relaxation strategies that can be really helpful in dealing with stress and anxiety. Some of them are simple breathing techniques that can be taught, and often this is something that a counselor or therapist could help train someone in. There's also mindfulness techniques that can help for relaxation. Meditation can be helpful. Simple things like listening to relaxing music can be a way of reducing anxiety. Also, yoga can be helpful. Some of these things may not be appropriate for the patient, but maybe for the family members. And then, as we discussed about sometimes in the treatment of depression, it can be helpful to have a therapist to work with on learning strategies to cope with anxiety, support groups, And sometimes medication can also be a helpful part to help someone with sleep or anxiety or depression.
This is a very important topic I've never paid attention to in terms of like we're doing today, so I really appreciate
Yeah, no
your
problem.
time in this.
Yeah.